Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab, as well as the SHA Emergency Operations Lead, Derek Miller. Minister Duncan.
Thank you and good morning. As students and staff across the province are heading back to school this week after the holiday break, the province is continuing to support schools to provide as safe of a learning environment as possible. We know that as COVID case numbers increase in the community and as Omicron becomes the dominant variant in Saskatchewan, we are going to see increased cases in schools. This is our reality. With that in mind, the province is continuing to support schools and school divisions in taking a layered approach, which includes continued masking, access to rapid tests, increased sanitation, cohorting, and encouraging all students and staff who are sick to stay home. As students returned to class this week, families were encouraged to use rapid tests that are widely available throughout the province to again further reduce the risk of transmission in schools. To date, schools have done a phenomenal job of maintaining in-class learning, and that work will continue in the new year as we all learn to live with COVID in our daily lives. And I want to thank our school divisions, all of our schools, our in-class and in-school staff, our teachers, for making this all possible. This is important as we know in-class learning is key to the development and health of our children and our youth, especially as we continue to deal with COVID in a third academic year. Last week, the province announced that if you receive a positive result on a rapid antigen test, you are no longer required a confirmatory PCR test, but will self-isolate based on your vaccination status and symptoms. Schools are now updating their process for notifying close contacts of cases with this modification in mind, with an aim to ensure that there continues to be timely notification and keep our classrooms as safe as possible. This means that if either a student or a school-based staff member tests positive from COVID-19, either by a rapid antigen test or a PCR test, they are asked to notify their local school office that they have tested positive for COVID. We are asking all students and staff to share this information so that those around them can properly self-monitor for symptoms and stay home if they are sick. This notification will enable the school to send communication to the impacted class or cohort. No identifying information will be shared about who has tested positive. Close contact students and staff who are fully vaccinated will follow the current process of self-monitoring. They are able to attend school and other activities as long as they remain asymptomatic. Families and staff also have access to rapid tests to assist with self-monitoring. For students who are close contacts and not vaccinated, they will continue to attend school and childcare as long as they are asymptomatic, but are asked to isolate from any other activities outside of school for 10 days. The exception to this is if the close contact occurred in the individual's own household. In these cases, all unvaccinated household members are asked to self-isolate, including from school and daycare, for 10 days. The self-monitoring or self-isolation period remains 10 days for close contacts, while it is 5 and 10 days respectively for vaccinated and unvaccinated individuals who test positive themselves. This is because it can take time for symptoms to develop for close contacts. So based on these scenarios that I've outlined, and that is mapped out in today's news release, there's a clear advantage of being vaccinated for those that are eligible so that students and staff can continue to participate in both school and all of their activities as long as they remain asymptomatic. Families and staff also have access to rapid tests to assist with self-monitoring. 250,000 rapid tests have been allocated for schools and are currently beginning to ship to schools across Saskatchewan. This is in addition to the 1.6 million rapid tests that have already been distributed to elementary schools from the federal allocation. Rapid antigen tests also continue to be available in more than 500 sites across the province. So if families have not yet done so, I encourage them to reach out to their local school or go to their local library or any one of the other locations listed on the website to get tests. Families can and should then make testing a regular part of their weekly routine. We all play a part in ensuring that we are being as safe as possible to allow our schools to continue to operate in-person learning, and testing is a great tool to support that. Vaccination clinics also continue to be open around the province. With the vaccination eligibility being extended to 5 to 11-year-olds, schools and families have an added layer of protection that wasn't available at the start of the school year. School divisions and schools also continue to have access to more than $150 million in COVID contingency funding that has been made available over the last 2 school years. $35.9 million of this is specifically being used this school year to support increased learning. And finally, to further support students' needs both this school year and going into the next school year, the provincial interim education plan will be extended into the next school year. This interim plan focuses on 3 key priority areas: supports for kindergarten to grade 5 reading levels, mental health of our students and staff, and to support those students whose education has been disrupted because of the pandemic over the last number of years. Dr. Shahab has joined us on the line, and with that, we'd be pleased to take your questions.
We'll start in the room. Lisa?
Every other province, every other territory but one have pushed back the start of school. Why is Saskatchewan the outlier? What do you know that they don't?
I think that there's a number of reasons for that. I can't speak to the specifics that are going on in each of those individual provinces in terms of perhaps their case numbers or hospitalization numbers. But what we do know in Saskatchewan is that we have a great availability of rapid tests that have been deployed all across the province, probably to the greatest extent anywhere in the country. And we know that certainly our hospitalization levels are lower than they have been for quite some time now. And we know that in-person education is important. Moving to extended absences or remote learning, extended period of time away from our students, their social networks, that is not consequence-free. And so we have worked very closely with our school divisions and with the SSBA, and there was, from that group, there was certainly no interest that was expressed to extend the holiday break, whether that be 2 days or a week. I don't think that there was a lot of value that was seen by those groups. Now, that's not to say that we likely will have obviously higher case counts in the coming days, and that may cause disruptions in the classrooms, but that's going to be the reality whether we extended the holiday break by 2 days or by an additional week or 10 days or whatever the matter would be. And we have had disruptions in the past as well in previous waves, and we have always worked very hard to try to ensure as much in-class learning as possible. And so we felt that because of all of those factors, a number of factors, that we were in a good position to start after the holidays. And obviously we'll pivot where we need to, depending on what case numbers do, but also what we see in terms of pressures on human resources, on kids' availability to be in the classroom. So there was a number of reasons, and certainly we are confident about kids returning to the classroom this week.
Follow-up, Lisa?
I'm not sure if this would be a question for you or Dr. Shahab, but what is the point at which you would make changes in schools? What is the threshold to when you would be pushing everything to online learning?
Yeah, I don't, I would say that like we've seen in the previous waves of COVID-19, we likely will see disruption in individual classrooms and perhaps in schools that will cause some move to remote learning. Now, the difference is obviously with vaccinated, especially our vaccinated staff, our vaccinated teachers, their time for isolation on a positive case is now 5 days. And so that will cause less disruption in terms of trying to manage the workforce within education, but obviously it could cause some disruption. And I know that, we're starting to hear stories about some concern in terms of being able to find subs, et cetera. So I'm not. I would say I would expect there will be disruption, like there has been in every single wave of COVID-19 in the classroom. That may require some, but to say that 188,000 students across the province all need to start at home this week, that just wasn't wasn't something that we felt was necessary at this time.
Take our next question. Jeremy?
Minister, you're telling parents to self-isolate if they have, or if their kid comes home with the case. I'm just wondering how health officials are going to ensure that self-isolation happens.
I think no different than it has been in the past. In the event that there was a positive case, obviously the order has been to self-isolate for whatever period of time was in place in the past. And now obviously, depending on vaccination level, whether it's 5 or 10 vaccination status, whether it's 5 or 10 days. And so, you know, we still expect people to follow those rules. If there is a positive case, they're required to isolate.
And then just a question for Dr. Shahab. We're seeing hospital numbers creep up just a little bit from yesterday's numbers, and case numbers are going up. Just what are you expecting these cases to have? Like, what impact are you expecting them to have on the healthcare system, on hospital?
Yeah, thanks for the question. So I think Derek Miller is also on and can add to that. So as the minister said, obviously the time for isolation is 5 days. And in many cases, you know, it could be based on a positive antigen test, but if you're symptomatic, based on a PCR test. And we have to remember that, you know, by the time you get your test result, you're already maybe at day 2 or 3 from the start of symptoms, or when you gave your PCR test, or when you tested your antigen. So a lot of the decision making around isolation and the end of the 5-day period is actually now going to be done by households, and public health will assist when it's a PCR test positive. But in the vast majority of cases, asymptomatic antigen positive, you know, you isolate for 5 days and then you continue to self-monitor. And if you're symptomatic, you isolate for longer. You know, we have how this will impact hospitalizations. Obviously, we are seeing hospitalizations go up a bit over the last week or so. We will be monitoring and sharing on a weekly basis total hospitalizations as well as hospitalizations by age group, and on a bi-weekly or monthly basis, obviously continuing to do detailed breakthrough analysis, which will look at hospitalization by age group, vaccination status, the impact of boosters on reducing hospitalization in the most vulnerable. But what we are seeing from other provinces and other countries is, and I'll ask Derek to confirm, is that as hospitalizations go up, a proportion may be individuals who screen positive, who will be reported separately, and of the rest, a proportion may be individuals who have comorbidities where COVID is a complicating factor, and then a smaller proportion may be hospitalizations only due to Omicron infection. And even there, I think other jurisdictions are showing more acute care hospitalizations with shorter length of stay, lower pressure on ICU. So all of those things I think we'll be monitoring closely, and I'll ask Derek to confirm. There'll be some reporting that will change end of this week, some that will be presented next week, and then on a weekly basis thereafter. But we also have to remember, as the minister said, we are just at the beginning of our Omicron surge, and schools are starting on time. We've done well over the holidays to minimize transmission events, but just like other provinces, we are a week or two behind maybe other provinces. We will at different times, and over the next 4 to 6 weeks, and in different parts of the province, see higher number of cases, and everything we do in terms of self-testing, staying home for those 5 days, and of course, continuing to get vaccinated and boosted is going to be critical to reduce our overall numbers, even though they will be much higher than we've seen before. And even though Omicron is less severe, even if it's a fifth less severe, but 5 times more transmissible, it will still cause pressures on the hospital system. But as long as we can prevent everyone in the province going up at the same time, quickly, that may reduce the pressures on the hospital system. But I think the pressure would also be on staffing in every sector, whether it's healthcare, education, as the minister said, other essential sectors like utilities. All those sectors need to have contingency plans to manage the work as a significant proportion of their staff are off sick, even though the symptoms are mild and you only have to isolate for 5 days. And I'll just pause to see if Derek wanted to add to that.
Yeah, thank you very much, Dr. Shahab. It's Derek Miller here from the Saskatchewan Health Authority. Certainly, hospitalization is a number that we are monitoring very closely. We're watching what's happening in other jurisdictions. As Dr. Shahab mentioned, they're a few weeks ahead of us. We are seeing and expecting that the rate of hospitalization will be less than what we've seen with other waves, which is positive. However, the higher numbers will probably still create some challenges for us. We are working through various contingency plans, which would enable us to be able to meet projected demand of Omicron hospitalizations. Later this week, we will be starting to share information about hospitalizations that are related to COVID as a primary cause of admission versus incidental COVID, those that are found to be positive when they're admitted for other reasons, but incidentally to another admission reason. So more information will be forthcoming on that. And I'll just finish by saying that the thing that each of us can do right now, in addition to following the public health orders that are in place and Dr. Shahab's advice, is we need to get vaccinated. Over the Christmas holidays, we did over 50,000 booster doses. So thanks for those people that came out to get their boosters. We have over 60,000 appointments available at SHA sites, plus available through walk-ins and community pharmacies across the province. So if you haven't done so, please get out there and get your booster shot or your first or second dose. Thank you.
Thanks, Derek. So we've got lots of questions on the phone lines today, so we will take our first question on the line.
We have Connor O'Donovan with Global.
Hey, so I'm just wondering, obviously, that today and in the past, it seems like rapid tests are a big part of the strategy moving forward to prevent some spread, but there's been some reports out there that question their effectiveness against Omicron. So I guess maybe for Dr. Shahab or whomever, what do you think people should know about the effectiveness of rapid tests and the reliability of them when they are such a big part of the strategy?
Like everything else, these are all layers that keep us safe. So rapid tests do work well against Omicron. They work quite well. And that's why, for asymptomatic people, obviously, if you're symptomatic, you should stay home till your symptoms are better, and you may go for a PCR test if your symptoms are significant respiratory symptoms and are worsening. But for most people who are asymptomatic and have concerns, or as schools asked all students and staff to do a rapid test, even if they're asymptomatic at home, the tests do work well. But obviously, all the other layers are important as well. Mask use at all times when you're outside the house, and cohorting, using our contacts as low as possible. So within that framework, rapid antigen tests work well. They're not 100%, just like anything else. And of course, the fact that we have, all the other mitigation measures in place is going to be critical, as well as, for the next 4 to 6 weeks, all of us trying to reduce a number of contacts, keeping a number of contacts as low as possible while you continue to go to school and work. Thank you.
Do you have a follow-up question, Connor?
Yeah, so with regards to the idea of not following up PCR tests, and many people are concerned about long COVID. Government says people don't need the PCR tests to confirm positive results anymore. Rapid tests aren't included in their medical records. So I'm wondering, given that there are some studies that suggest people who experience long COVID don't have any symptoms initially, how important is a proper diagnosis at the time of infection, and how does that affect ongoing treatment later on?
Yeah, the question of long COVID, there's increasing information evolving on that. And, thankfully, there's evidence that if you're fully vaccinated, irrespective of whether or not you had COVID in the past, that reduces your risk of long-term symptoms, long COVID symptoms or residual symptoms that are more common if you are seriously unwell. We have to also realize that, in the old days, with the earlier variants, up to 30-40% of tests would be of cases would be asymptomatic, and the correlation with long COVID is not always based on severity of symptoms, but with Omicron, a higher proportion of cases may be asymptomatic. So I think we have to balance the fact that we need to conserve PCR testing for people who are symptomatic, have worsening symptoms, use antigen testing if they're asymptomatic, and as appropriate, to make decisions about isolation. But if you're symptomatic, if you have other underlying risk factors that may complicate your clinical management, if your antigen test is positive, having that discussion with your healthcare provider, and if they recommend a PCR test, that may be appropriate. But we have to remember that even the PCR test, may not be positive because your symptoms may have been days or weeks earlier. So I think having that discussion with the healthcare provider for managing your other conditions is going to be important as well.
We'll take our next question. We'll take our next question on the line.
We have Stephanie Davis with CTV.
Hi, the Saskatchewan Teachers Federation says it has asked for school, or it did ask for school to be delayed by 2 days, so teachers could get some safety protocols, I guess, in place. Why was that specific request denied? Just from what's been announced here today, it seems like nothing has actually changed inside of schools compared to what was already in place.
Well, we certainly heard their call for a 2-day pause, working with school divisions and administrators who operate the schools across the province. Didn't feel like 2 days, a 2-day pause to the resumption of school beginning this week would have provided a value or benefit. I think everybody is aware of what we're dealing with and the layered approach that's been put in place by school divisions and by the province, by Dr. Shahab and his team. And so we were working with school divisions and schools across the province. We're confident that our plans are in place. Nothing really would change in those 2 days in the event that we did take the STF up on their offer of delaying school for 2 days. So we're comfortable with that. We're confident that school can return with the understanding that what we're dealing with in terms of this variant, and likely there will be at some point disruptions in individual classrooms and individual schools. But that will be the case whether school started on Monday or whether it starts today.
You have a follow-up question, Steph?
Yeah, thank you. I'm not sure if this is for Dr. Shahab or someone else, but just wondering if there are any support systems that will be put in place for long haulers who need to prove they're positive with a PCR test for insurance purposes.
Unless Derek has something to bring at this point, these are complex questions, and of course, with any infectious illness or any illness, there can be implications for recovery, whether you are hospitalized or not. Certainly, we can bring back some of the work that's been happening nationally and provincially on managing ongoing symptoms of COVID, which may not always. We already know that people who require hospitalization, especially ICU care, need a longer time to rehabilitate, especially if their ICU stay was long. And that is, not unique to COVID. That could be with any other severe illness, but there are some unique attributes to COVID resulting in serious outcomes requiring hospitalization where, rehabilitation continues, especially if you're ventilated, for example, or had other COVID-related or non-COVID-related impacts. So that generally doesn't come in the purview of long COVID, and that's a recovery from a severe illness requiring ICU care. And again, I have to emphasize that irrespective of prior exposure to COVID, it is vital that we are fully vaccinated and those who are 18 and over are boosted. But then, of course, there are very specific clinical syndromes that may happen irrespective of whether you're hospitalized or not. that can be classified as long COVID symptoms that still require clinical management, and clinicians don't always, require confirmation of COVID illness if the symptoms are consistent with what's known about post-COVID symptoms. But certainly we can bring some of these questions back and also consult. But generally, we have to remember that in Canada, access to healthcare is universal, and we should not face the same limitations of accessing healthcare that may exist in other parts of the world without access to universal healthcare. But specific questions around confirmation of whether these symptoms are due to COVID based on a PCR or antigen test, I think we need to understand that that is not always possible, because in some cases the PCR test may not have been done at a time when the symptoms were mild or a person was asymptomatic. But again, I have to emphasize that for the most part, the most significant impacts of COVID are correlated with the severity of the initial illness, and that is mitigated to a dramatic extent by vaccination and now increasingly by boosting. But some of these questions I think we can bring back for further comments. Thank you.
We'll take our next question on the line.
We have Alex Saloom at the leader post.
Hi there. Just to run a few quotes back here. Dr. Shahab, you said, this is just the beginning of our Omicron surge. Marlo, you said we're watching what's happening in other jurisdictions. So Minister Duncan, given what we've seen elsewhere in Canada, Quebec specifically, I know in America a number of divisions have gone to remote learning. We're at the beginning of this thing. Why not take the precautions right here and now to delay this for a little bit as Omicron comes through the province? I'm just trying to understand specifically the rationale as to why there aren't these measures in place right here and right now.
Yeah, thanks for the question, Alex. So I think we're trying to weigh a number of considerations and balance our approach as we look to return students this week to the classroom. And I would say that I would say that, as I said before, it's not to say that we won't have disruptions in the classroom in the coming weeks and months as we make our way through this wave of Omicron. But the question really was, do we require 188,000 students to start the school year on January 3rd at home? And for what period of time? We felt that we could safely bring students back, knowing that there likely will be disruption. We have put in place, working with school divisions across the province, put in place a layered approach to mitigate as much of the risk of transmission as possible within the schools, and schools have done a great job, whether it be Delta or any of the previous variants of COVID-19, to mitigate the risk for students and staff in the schools. And so we felt like we were in a position where we could safely restart school for students in-class learning. We know that in-class learning is vital for the not only educational but social development of a student, particularly as we know, in the third school year for many of our students dealing with COVID-19. So again, we may have to change course as we have all along, and classrooms and schools may need to pivot and to change to a different direction. But we felt we were in a good position to start this post-winter holiday break with as many students as possible in the classroom, and that's the decision that we took.
You have a follow-up question, Alec?
This one I suppose will be for Marlo and Dr. Shahab here, and it'll be kind of blunt. With respect to COVID-19 in the province right now, what's the plan? There was a time where we had flattened the curve, keep as many people out of hospital as possible. We're the only province that doesn't have additional restrictions. Our province isn't doing remote learning. So right here and now, as we see, the beginning of the Omicron variant taking over the province, what's the plan?
Thanks for the question before, and I know Dr. Shahab will have extra comments on this, but I think what the plan is we are leading the nation in regards to our rapid test kits. We have distributed, as of January 4th, over 12 million tests. We have, as of January, over 600 sites in this province, including the test kits that we're sending to the schools. So that is the plan. The plan is about the self-testing, the self-isolation when you're exposed. It's about all of us taking a role in this, but we have the preventative tool available for every one of us to get within a very short distance test kits to do self-testing, self-monitoring, and that is what will be driving a lot of our decision-making moving forward. So with that, I'll turn it over to Dr. Shahab if he has anything else to add.
Thank you. And what I would just add is that we came out of a very significant fourth wave, Delta wave, end November, early December. Some other provinces entered their Delta wave in November, December. Omicron was not really known as an issue till mid-November in South Africa. And very quickly, in an unprecedented fashion, it has become the dominant strain in Saskatchewan, Canada, North America, Europe, most of the world. It has really, because of it's very transmissible, it has quickly, replaced Delta. On a positive note, as we said, it is, while it's more transmissible, it does seem to be less severe, especially in those who are, fully vaccinated and now boosted. And what this means for the next, 6 to 8 weeks and maybe up to 12 weeks is that, we are entering a different phase of the pandemic where initially, it is very important to contain the virus and to mitigate the impacts at the clinical level. Now that is also important, and that is why vaccination is going to be critical, remain critical, as well as early access to therapies like monoclonals and in the future antivirals for those who are at higher risk. And of course, protecting yourself through using your best mask. But now, right now, Omicron is behaving more as a respiratory virus in a pandemic, which is more transmissible but lower pathogenicity. So the challenge right now is business continuity in terms of staff available to work in healthcare and education, other essential sectors, as well as able to keep our grocery shelves stocked and trucks running. So it's a very different stage of the pandemic, and that is going to be important to manage over the next 6 to 8 weeks, up to 12 weeks. What does the future hold beyond 3 months? I think most experts have stopped predicting the future, but I think on a positive note, the fact that we are we have high booster uptake, 60 and older, more than 2/3 of people 60 and older and even higher 80 and older have received a booster. We were really ahead of the curve in terms of enabling booster access, 80 plus in September, 65 and older October, 50 and older November, and now 18 and older in December is important. It's important that we now step forward, those of us who still haven't been boosted, 18 and older, to get boosted in January. That's going to make sure that our Omicron surge has the least impact on the healthcare system. And we need to make sure that we, through all the things, self-testing and staying home if you're asymptomatic but positive 5 days, all the other measures, we keep our peak of the curve as low as possible and not coming at the same time, and to get over this Omicron surge over the next 6 to 8 weeks, and likely up to 12 weeks if it comes at different parts of the province at different times. I think that's going to be the key right now. But like I said, this is a very different phase of the pandemic where service continuity is as important or more important than just severe outcomes, which for most people who are vaccinated and boosted is less of an issue. But that still doesn't mean that we should not minimize our risk of exposure while still being able to provide ongoing care. Thank you. Thank you.
We'll take our next question on the line.
We have Adam Hunter with CBC.
Hi, thanks for taking my question. For the minister, you mentioned disruptions in the classroom. It seems, just hearing from schools and parents and teachers, that there's an issue with teachers isolating right now. A large number of teachers are out of the building because they're having to isolate. Do you anticipate that being one of the causes of disruptions? And if so, what's the plan for that? Should parents plan to have their kids online if there aren't enough subs, for example, in a given school division or in a school? Because previous disruptions have really been caused by classrooms having numbers of cases, not necessarily the lack of teachers. So what do you anticipate on that? What should parents expect? Is the government planning to do anything about that if that happens?
Yeah, thanks for the question, Adam. So we're working very closely with school divisions. My deputy was on a call this morning with school divisions to assess the situation, and certainly we know that school divisions are seeing some of that beginning now, and school divisions are starting to put in place plans in the event that does continue in terms specifically with teachers having to isolate. So, you know, we've been through this before, though. We have 2 years of experience of this, and so I think school divisions are getting well adapted at pivoting when it comes to perhaps online learning or cohorting classes, bringing in substitute teachers. So that work is going to continue over the coming days and weeks. So I would say, and I know this myself as a parent with a child in the school system, we're prepared for whatever comes at us. So I think parents should be prepared for a changing situation depending on what COVID-19 brings to us. But I would say that, again, that you know, school divisions are on top of what is taking place in terms of whether it be teachers or students or other staff, and will adjust their plans as they need to.
You have a follow-up, Adam?
Yeah, this is related to how the government's going to judge, you know, how bad things are getting. If they do get bad, we're not going to have as good of a sense of cases because of people rapid testing, not reporting those tests in, you know, PCR requirements, those sorts of things. How is the government in Dr. Shahab going to judge when and if to make recommendations or introduce anything? You know, the Dr. Shahab has said in the past that maybe gathering limits or capacity limits could come into effect. I just want to know what we're using that to judge on. Is it going to be hospitalizations? Is it going to be PCR tests still? What's the marker for us to watch, I guess?
Yeah, I'll maybe start, and then Dr. Shahab, if you want to answer. So, you know, first and foremost, what already exists continues to be in place. So PCR, positive PCR tests that are confirmed through the SHA testing, those do get reported through the normal channels. And so whether it be while the schools and school divisions working with their LMHOs making a determination based on those numbers that they do receive in terms of the confirmed PCR tests, and making decisions on whether or not, for example, an individual classroom would be required to go online for a certain period of time. We are asking that parents report in to their school a positive rapid antigen testing, and we're working with school divisions and with the SHA on how we will report those publicly. Obviously, it's on the honor system, and so it's going to be an incomplete number, but it, you know, hopefully will provide somewhat of a picture for parents that are interested to know what's happening in their child's school or in their child's classroom. And between those two factors, obviously, the absentee rate of students will come into effect when it comes to an LMHO making a decision to close a classroom down. So that's what's in place. I will note too, Adam, just I guess on your previous question, you know, just keep in mind though, assuming we're talking about a fully vaccinated teacher, for example, or other in-class supports, a positive case, the isolation time is reduced to 5 days. So that will help to hopefully keep in the event that there are teachers or other support staff that are isolating because of a positive case, the length of time that they have to isolate is lower than it has been in the past. So that will help to keep maybe not the specific teacher that has to isolate, but it'll bring them back to the classroom hopefully sooner than they previously would have been allowed to come back to the classroom. But Dr. Shahab, do you want to speak to Adam's second question there?
Yes, thanks. I think at least for Omicron, we can watch closely what's happening in other countries, Western Europe, UK, the US, and as well as other provinces. So we know that we need to conserve PCR testing for symptomatic. And as a result of that, we are seeing high positivity. So right now, our testing rates are good, even though we know that there's a lot of antigen testing happening. That again is very important and very good. Our test positive rates are in that 20 to 30% range, so higher than they've ever been, which we expect to see because that is exactly what's been reported in other provinces. And initially for the first 2 to 3 weeks, most of the Omicron cases, as expected, were in young people, 20 to 39, with no increase in hospitalizations. But as Omicron impacts people who may be older, who may be unvaccinated, who may have other clinically vulnerable risk factors, we do expect to see some increase in hospitalizations, mostly acute care, again, that we are starting to see. So again, there's nothing surprising that we are seeing. Obviously, we're monitoring this very closely. Obviously, my recommendations to reduce unnecessary contacts as much as possible as we go to school or work is going to remain critical as we move forward, as well as, of course, wear your best mask, get vaccinated, get boosted. But obviously, we are watching very closely what kind of measures are having what kind of impact in other provinces that are seeing a much higher surge in the face of a more transmissible variant, and what measures are required to keep essential services continuing. And obviously, my recommendations will continue to evolve based on that, especially the experience for other provinces. But I have to say that, with the Delta wave, with our current measures which remain in effect, mask use in all public places, with the added caveat to use your best mask properly to adjust for the higher transmissibility of Omicron, as well as other measures like proof of vaccination, a negative test, but of course now a much higher usage of antigen testing, even if you're asymptomatic. Hopefully these measures alone will, to some extent, reduce the surge to some extent, but we will see a surge higher than what we've seen with other variants, but with a lesser impact on the acute care system. But again, we'll have to monitor how things develop in Saskatchewan, and also how the surge is being managed in other provinces.
Thank you, Dr. Shahab. Thank you, Dr. Shahab. We'll take our next question on the line.
We have Zach Becerra with Star Phoenix.
Hi, thanks for taking my question. I have a question for Derek Miller. Derek, you mentioned incidental hospitalization data briefly and said more information is forthcoming. Just so we know, though, are so-called incidental hospitalizations currently reflected in COVID-19 hospitalization data?
Derek, are you on the line?
I can confirm that that is being done, that hospitalization reporting will be broken up to those individuals who are in for another reason and screen positive with no symptoms or clinical conditions that can be explained by COVID, versus individuals who are hospitalized due to COVID alone, or who have underlying clinical conditions such as chronic lung disease, immune suppression, and COVID is a complicating factor resulting in the hospitalization. So that reporting will start end of this week, and we will speak to this at length next week. But I just wait to see if Derek can add to that.
Yeah, sorry about that. Couldn't get off mute. Yeah, that's correct, Dr. Shahab. So those incidental COVID, so if you're in for an arm fracture and then during normal screening process you're found to be COVID positive, you would show up in our numbers as a hospitalized COVID case today. And so that's one of the things we want to see clarified going forward, because you would be identified in that case as an incidental COVID hospitalization. So more to follow on how we're changing the reporting to reflect that.
Do you have another question, Zach?
Yes, I do. I have kind of a follow-up here on Alex's question earlier in terms of what the plan, or the strategy, or the message is here. And I feel like there's a lot of kind of public confusion about what we're actually working towards in this Omicron wave. I guess the most kind of pressing question for me is, if government doesn't want to introduce restrictions on gatherings or businesses or anyone else, I know no one likes those restrictions, then why should members of the general population take this more seriously? Why should members of the general population be limiting their contacts and going to those extra steps if government isn't willing to kind of lead the way on that?
Well, thanks for the question, Zach. I would just say that, first and foremost, we have put in place significant measures to deal with COVID-19. Proof of vaccination, proof of negative test is required for entry into to a number of facilities or locations around the province. That is, I think, a pretty significant step. What we're saying here today is that we know that we should expect that cases are going to increase. But we've said all along, and I think what Dr. Shahab has been very clear about, is that schools should be the last to close and the first to open. And so we want to make every effort to have as many students as possible in front of a teacher. And we think that we're in a position to start the return to school this January in that way, and knowing that we may have to change course along the way depending on what Omicron presents to us. So I think that that's really what we're trying to get across today.
And we'll take our next question on the line.
We have Lara Fominov with CKOM.
Hi there, can you hear me okay? Hello?
Yep, go ahead, Lara.
Okay, sorry. Right now, Saskatchewan, according to yesterday's numbers, has just over 4,000 diagnosed active cases. So considering the R0 factor of Omicron right now, what do you estimate the actual number of cases considering you're asking people to self-diagnose? So how many cases basically are we not catching? Is it 2, 3, 4, 5 times that number?
So, right from the beginning, we know that, we were never able to capture 100% of COVID cases. In the initial wave, when in March 2020, when it was almost entirely international travel and household contacts, we're capturing maybe 80-90%. With our fall surge in 2020, we were capturing maybe 60%. With Alpha and Delta, we were again capturing around 60% because it was, Alpha and Delta were more transmissible than the original strain. But our testing kept pace with PCR testing kept pace. But even then we knew that 40% of transmission was asymptomatic or minimally symptomatic and not being captured, and that was accounted for in the projections. With Omicron, I think the UK and other countries are saying that even with high rates of testing, both PCR and antigen, there may be an additional 60% individuals who may be asymptomatic, may not even test positive because the antigen test is not done at that point. And so, that is going to be most likely with Omicron. And for most people who remain asymptomatic and either antigen test positive and isolate for 5 days or are unaware of their symptoms, that would not result in any long-term impacts for them, especially if they're already vaccinated and boosted. If anything, it will just further enhance their immunity to future variants. But with that reality in mind, I think it is important at the same time that for those who have clinical symptoms and have, especially those who are underlying risk factors, they do go forward for a PCR test. But while our PCR test rates will inform us to some extent, obviously our hospitalizations, although a lagging interval, will also inform us, and we have additional tools like wastewater surveillance. But the proportion who are asymptomatic was as high as 40%, and that may be even higher with Omicron. But on a positive note, for most people, an Omicron exposure will be uneventful in that you're asymptomatic or you have minimal symptoms for a day or two, and that's especially going to be the case for people who are fully vaccinated and also for people who have received a booster dose. Thank you.
Follow-up question, Laura?
Yes, thank you. So right now, Ontario and Quebec, especially, well, in Quebec anyways, there are sometimes hundreds of hospital staff at one facility that have contracted Omicron and need to be off work. So what are Saskatchewan's plans for potential staffing shortages in hospitals as this fifth wave hits us?
I think I would ask Derek to speak to that.
Thanks, Dr. Shahab. Derek here. It's a very, very good question, and certainly we're watching with a lot of interest in terms of how this is impacting health systems in other jurisdictions, specifically for healthcare workers who become COVID positive or become contact and need to isolate. So far in Saskatchewan, because we're earlier, or I guess later in the wave compared to other jurisdictions, we're only just starting to see a potential increase in sick days and healthcare workers being absent, and not yet seeing a significant impact on services. But in anticipation of that likelihood, we are developing contingency plans that would allow us to minimize the impact of staff being off due to COVID as a case or contact, and are working with their teams in order to mitigate the impact that might have.
We'll take our next question on the line.
We have Nathaniel Dove with Global.
Hi, can you hear me okay?
Yep, go ahead, Nathaniel.
Okay, so my question, I guess for the minister, do we have, some students and staff have already returned to school, returned to the classroom, and I know some have already been exposed or potentially exposed to COVID, some others have already gone out. Do we have a sense as of today how many staff are already in isolation, or staff and school members are already in isolation, and how many are already considered to be close contacts? And I should ask for a number of students as well.
Yeah, Nathaniel, I don't have that on me. We'll try to find that for you and follow up with you after, but I don't have that available.
Do you have another question, Nathaniel?
Yes. Sorry, just going through my notes here. I guess moving forward, everyone on the call today is saying that you're looking ahead to other jurisdictions to see what's happening. Other jurisdictions are taking stronger measures. Students are learning from home. There are gathering restrictions in place. I'm curious, as we move forward, is there a plan in place? Where will the restrictions come first? Will they come on schools, or will they come on gathering limits?
Well, we'd certainly have to obviously follow what the numbers are telling us over the next coming days and weeks. And I think, as Dr. Shahab and others have alluded to, obviously that with a variant like Omicron, it really is hospitalizations and ICUs that are going to be the critical numbers to keep an eye on as we go forward and make decisions. I would just say today where we're at is that we feel that the best place for students to be is in a classroom, in front of a teacher, for as long as possible. And there, in my mind, and I think this was shared by the school divisions, there wasn't a compelling reason on January 3rd to tell students to go home for 2 days or 10 days or 3 weeks. Now, that may change for particular classrooms or particular schools or particular parts of the province, depending on what numbers look like over the coming weeks. But that's not the case today. And so I think we're very comfortable that students are in class. We have a layered approach that has worked well to mitigate the risk of transmissibility in schools, not to say that it is zero, and acknowledging that Omicron, the transmissibility is certainly higher than it has been in previous variants. But we know that there is a balance that needs to be found. And I think other provinces are looking at that as well. We know that obviously we want to mitigate the risk of transmissibility in schools as much as possible, but we also want to mitigate against the consequences of having students out of schools and outside of classrooms, not in front of a teacher for an extended period of time. And particularly for students that have been through this now for a third school year, and this has had an impact and a toll for a lot of kids out there. And so we want to try to balance all of these different factors, and again, felt confident that while things may change, for the vast majority of our students, we could return to in-class learning in front of a teacher and continue with that and change and pivot as we have had to, including under Delta, where we didn't shut schools down. We moved classes, and school divisions had to move classes to remote learning from time to time, depending on specific situations. But we didn't send all 180,000 plus students home. And we're trying not to do that now as well.
And we'll take our next question on the line.
Phil Tank with Star Phoenix.
Yeah, thanks for taking my question. I'd like to ask about testing. It seems that we saw the walk-in testing in Regina and Saskatoon have to close down midway through the day. There's obviously a lot of demand for testing. I guess I'm wondering why we don't seem to be able. And I also heard that if you want to book a test in Saskatoon, it's 10 days, and that people are booking tests in smaller communities outside the city. I guess I'm wondering, we seem to have been doing twice as much testing. I'm just looking at the numbers here during the fourth wave in September and October, and I don't recall, these lineups of 3-4 hours and people being told, well, we're done for the day. I mean, are there plans to devote more staff to testing, and what are the issues that we're facing with testing? Of course, I'm just talking about PCR testing here. There's obviously people, if they're following the rules, who have symptoms who aren't getting tested right now. How concerning is that, and are there plans for any changes?
Derek or Dr. Shahab, are you able to answer that?
Yeah, thank you. And we are aware that in some test sites in the province, you mentioned Regina, there were a few days where the lineups were longer, and also waiting longer times in order to actually book appointment for a test. So we are working to augment our resources in those locations and ensure we're able to meet demand. But I will also just echo comments from Dr. Shahab earlier in terms of individuals trying to preserve the PCR testing that's available for those that are symptomatic, that people, if they test with a rapid test and are positive, that they don't need to seek a confirmatory PCR test. And so this is a change from the historic practice throughout the pandemic, and it does cause some change for people who historically have been able to access that PCR testing. So we're asking for the public to be aware of that change, to really utilize the rapid tests that are in place and easily accessible across the province.
You have a follow-up question, Phil?
Yeah, I mean, I guess kind of unrealistic to think that people without symptoms are sitting in cars for hours waiting at a walk-in clinic. So, I mean, I'm guessing that most of those people who are in the lineup do have symptoms. I mean, I can't imagine doing that myself. And to what degree do you think, should someone, need to be off of work, say they have, lingering symptoms from COVID? how is a rapid test going to satisfy maybe workers' compensation or other, has much thought been given to that? What if someone has like long-term implications from COVID and they can only say, well, I did a rapid test, and I guess they could take a photo of it or keep the rapid test. But I mean, I'm not sure that's the same thing as getting an official diagnosis. So is there concern about moving, all of these numbers from, being official diagnoses to, at-home test? I mean, if you tested positive with an at-home pregnancy test, you wouldn't just say, well, I don't need to go to the doctor, right? You go to the doctor and have it confirmed. So I'd like an answer on that.
Yeah. So maybe I'll just make a few comments, but we can then have statements to the media or have, labor relations, workplace safety, workers' compensation board speak to some of these aspects as well. But I think we have to understand, and we all have a role as employees, employers, and members of society in this, that, because Omicron is more transmissible, and because right now we are in January, it's very cold, the air is dry, there's a lot of people with, upper respiratory symptoms. And obviously, if you have symptoms that may be COVID, and those are, with Omicron also, they are, for the most part, they are pain in the throat, a sore throat, fever may or may not be present, aches and pains, malaise may be present, and a runny nose may be part of Omicron or other respiratory viruses. Those are the situations where obviously you should stay home till you're symptom-free, and you can seek a PCR test. If you're asymptomatic or you're concerned, you should do an antigen test, not go for PCR testing. And again, like to remind everyone that if you require a test for travel or other purposes, medical insurance, there is access to both PCR and antigen testing, not just self-testing, but antigen testing, outside the SHA. So there is, individuals who require testing for travel must access not the, SHA testing stream, but what's available, both PCR and antigen tests through other providers. But there will be pressure on PCR testing, and further guidance may be required that if your symptoms are mild, you're otherwise well, should you go for PCR testing if that means that people with more severe symptoms who are required for clinical decision making, and that guidance may come based on what the supply and capacity is to provide PCR testing, because we have seen in other jurisdictions that sometimes even the capacity of PCR testing does get exceeded, not just on a day-by-day basis, but sometimes for several days beyond the capacity of the system to provide that. But I just want to reiterate that, at the end of the day, COVID is not is ubiquitous through society. Omicron, especially, I've said in the past that more of us are going to get exposed to Omicron than were exposed to the earlier 3 waves or 4 waves altogether. It's just a matter of that it is more transmissible. But for the vast majority of us, especially those who are fully vaccinated and boosted, it will be an asymptomatic exposure, or it will be with mild symptoms. And I think we just need to take that into account in terms of what that means for us for staying at home for just 5 days if we test positive, staying at home for 24 to 48 hours still be symptom free if our symptoms persist for those more than those 5 days. But those are those acute symptoms. Some of us may have a dry lingering cough for more days after that, which doesn't mean that we're infectious. You're not infectious beyond 10 days for the most part in any case, and we have to wear a mask at all times. So I think it is going to be a challenging time for employers who have to keep workplaces running, especially for essential sectors like utilities. It's going to be a challenging time for households where you may have a parent who's unwell or a child who's unwell, and we all have to get through this together. Thank you.
And we'll go to our last caller.
We have Luke Simard with CTV.
I'm just looking for some clarification on the isolation rules. If you're 5 days past your positive test, are you still clear even if you show symptoms?
So people who are asymptomatic, you're fine on day 6 if you're fully vaccinated to be able to go out wearing a mask. But if you developed, if your antigen test was on day 1, you developed a fever on day 3, and you still have a cough and fever day 5, obviously you should stay at home till you're symptom free, which may be day 6 or 7, and then you should be fine. But you should also still wear masks for up to 10 days, and in most workplaces, schools, you have to wear mask anyways. And we, at least for 10 days, if you're a case, you may want to not visit someone in long-term care and or someone is high risk as an added layer of precaution, because up to 5 to 10% of people may still be transmissible at a low level beyond that 6-day mark. But beyond that, I think like with everything else, if you get any other respiratory illness like pertussis, you have that acute phase where you're infectious and symptomatic, but you can have a dry cough for days or weeks in some cases, which doesn't mean that you're infectious. So I think most people can make that determination or can call and have a discussion with Healthline or the healthcare provider. And the other thing, of course, is that for many people who have asthma, chronic lung disease, heart disease, this is the time to make sure that you are optimizing your medications and managing your underlying risk factors, especially respiratory illness that can also get aggravated if you are exposed to COVID as well. Thank you. But then, the aggravation of your underlying chronic condition doesn't mean that you remain infectious for a longer period of time. Thank you.
And do you have a follow-up? And do you have a follow-up question, Luke?
No.
Great. Thank you, everyone. That concludes today's availability.